So South Africans will know today the outcome of the Covid-19 PCR test prices. This comes after the Competition Commission reached an agreement with two major laboratories. In October, the Commission conducted its investigation after it received a complaint from the Council for Medical Schemes concerning the PCR prices. The Council argues that the price being charged by some private laboratories is exorbitant and unjustifiable. The Covid-19 testing price is currently set at 850 Rand per test by some private labs, and the body wants it to be reduced. Now, joining us to expand on this is Dr. Aslam Dasoo from the Progressive Health Forum. Dr. Dasoo, a very good morning to you. Thank you so much for your time. We're really looking forward to that announcement as to what the prices could look like. But let's just talk about how it's been expensive from the start for something that has been so critical and key to our COVID-19 response.
Good morning. Thank you for inviting me. Look, there needs to be some context to this. These are prices. The price you, for example, mentioned, the 850 Rand, is for the PCR test, which is the main test that is done for COVID. And it is a prescribed minimum benefit in the medical scheme industry, and if you are paying cash at a private facility. So that price was set when it was at a time when the tests were, still new, and there were very few of them, and the supply was tight, and the high prices came in. But once it was a prescribed minimum benefit, medical schemes and labs agreed on that set price, and that's normally how the tariff works for a year. However, in this rather extraordinary situation, we know that the number of tests have increased dramatically, the supply has improved dramatically as well. The state sector, which doesn't charge anything for the same test, has found that its base cost has reduced, and we presume that will be the same in the private sector. But the amount charged hasn't come down, so the cost saving over time has not been passed on to consumers. And it is proving to be quite a deterrent for people to get the test.
Now, how will they, drop this, Doctor? I don't know if you at all will be able to give us some insight as to where they'll find then the money. Will it be subsidized, or will it just be a matter of taking the cut as a knock on the chin?
I'm hopeful that it's going to be the latter. Clearly, that once supply improves, and that the ability to reduce costs is there, that's actually what should happen. Of course, it's not just the cost of the test. It's the cost of their staff, their equipment, their other overhead costs that are all built in. Now, those are perhaps fixed costs. We have to accept that. However, the cost of the actual reagents and the other material used in the test have come down quite significantly. And that saving, I think, should be passed on. There's no reason for the labs, which have really made huge amounts of income over these tests, some 8 to 10 billion Rand for the amount of tests done among three major labs and a few smaller ones, is a huge amount of income that I think in these extraordinary times, in the crisis the country faces, that the labs would do well to reduce the costs to a significant degree so that people can access the tests. The Competition Commission would be looking at it with that kind of view. And that was the basis of the complaint from the Council for Medical Schemes, because whether you're paying out of pocket or your medical scheme is paying, the cost is coming through to you. Because the increased payout by the medical schemes will be priced into your premium as you pay it. So it's all linked, and I think it would be very useful if the Competition Commission reaches an accord with the labs to reduce the costs significantly.
Absolutely. Let's quickly talk about the country's response to COVID-19, Doctor, just for a brief moment. I know you've been critical, to say the least, of some factors in the response for COVID-19. I want to mention misgovernance in particular. We know that PPE fraud is or corruption is something that is now, the president is looking into, but it's really cost us quite a lot and hampered our response, hasn't it?
It certainly has, and I think look, we know our economy is constrained. We know public spending is very, very tight, and so the amount that is set aside for the response to COVID. If it's purloined, if it's squirreled away or stolen, just reduces the amount available for the response. And the response will be, attenuated as a result, and people will suffer the consequences of that. We have seen that. So the question of corruption, though, is and around the PPE. It was probably facilitated by utilizing certain provisions that avoided having to go through the usual checks and balances of procurement, and people made hay out of that. That's certainly what we've seen out of the preliminary reports from the SIU. And it's completely unconscionable. But it is a difficult thing because the government is riven with corruption in many departments, not just in health, even though health could be regarded as a bit of a poster child of misspent public funds. This SIU report, one hopes, will allow us to have a handle on that, certainly in the health department, and try and staunch the flow of funds into inappropriate sources.
Dr. Aslam Dasoo, I really thank you for your time this morning. Dr. Dasoo is the convener of the Progressive Health Forum.